ladies and gentlemen, this is Taylor here, and welcome back to Operate Now. We're going to be playing 3 more games here, so let's get right into it. Alright, we're in the hospital now, and we have Nurse Laura with us today. So, we're gonna jump right in. Alright, don't try this at home. Obviously not. Your patient Ashley... Sorry. Your patient Ashley is experiencing breathing difficulties due to deformations in her nasal cavity. Today, we are going to surgically reshape Ashley's nose to improve airflow and resolve her breathing complications. We'll also give her nose a more aesthetically pleasing shape. Why do people do that to themselves? I believe we are all made in the image of God. You don't need a nose job. I'm gonna give her one anyways because I'm her doctor. I gotta give her what she wants. Since this is a heavy procedure, Ashley will first need to be fully sedated prior to starting the operation. Alright. Now let's just wait for Ashley to fall asleep. Shut your eyes, go to sleep. Good work! Ashley should remain unconscious for a couple of hours. We now proceed with the operation. We will first open the nostrils using a retractor. Pick up the retractors from the table. Alright, here we go. Great work! We will now make the first incision. Alright, there's obviously gonna be blood in this. This is a surgery. So, here we go. Turn it. Oh, I forgot. I have another mouse here. Ooh! Good work! We will now use scissors to open the nostrils even further. Oh boy. Oh, I hope this goes very well. Ashley nose is bleeding heavily. No kidding, Sherlock. Alright, there we go. Alright, pick up the scalpel. Alright, there we go. That's the septum? Oh my gosh. Like I said, these games are... Most of this... Some of this isn't even, medically accurate. Alright. No time for talk. Alright. Pair of scissors. There we go. Ooh. Oh, that's gross. Alright. Osteotome. Alright, the rubber mallet. Alright, we're gonna beat the crap out of her face. So we're just gonna boom, boom, and boom. Alright, now the bonus is to pick up the tweezers. Wait, that looks like just like the septum. Alright, smooth it out. The rasp. There we go. All nice and clean. Very good, doctor. We are now close to space left by the removed bone. Except osteotome. There we go. Shove that right in there. Boom. Boom. Alright. We're just gonna reshape that. Wow. We're almost done. Let's look at the needle so we can suture the nasal tip. Ooh. Oh! Oh man! Alright, there we go. Suture for you, suture for you, suture for you. Alright. Airway splits. Stuff that right in there. There we go. External nasal split. There we go. Bandage. There we go. You did a great job, Doctor. I'm sure Ashley will recover in no time. Yes! I did it! And she looks like she got into a bar fight. Okay, someone's back is messed up here, so we're gonna fix that by doing scoliosis surgery. There we go. Hey Lisa, She's a patient with scoliosis. This has led to poor posture, and she is beginning to experience significant pain. We must operate immediately. We'll have to perform a spinal fusion. Oh. Alright. Okay, doctor. We need an X-ray to see inside the patient's chest. Let's get her to the X-ray room. It should be one of these 3 rooms. Obviously, it's this one because this is the X-ray. Right. Darn it. And boom. Good job. This is an image of the spinal column. It definitely has an irregular shape. Also, what is that right there? Okay, doctor, we need to move the patient to the operating room. It should be one of these 3 rooms. Alright, it's this one. Whoa! Where did that come from? Dang it. Alright. Let's shove that in there. For the patient to fall asleep. I'm gonna sterilize the patient's back. Please pick up the tongs. Alright, there we go. Obviously we need a cotton ball and a septic solution. Table. Draw a nice line right there. Now we are ready to make the first decision. Please pick up the scalpel to begin. Oh boy. Alright. Hold on to your butt cheeks. This is about to get ugly. Ooh! Alright, let's open it up. Here we go. Oh! Place the drill to make 6 holes in the bone. I hate having things get drilled inside of me. I'll pick up the rods from the table. Alright, there we go. There we go. Good work, guys. Let's pick up the screws from the table. Alright, I'll just go to Lowe's real quick. Alright, I'm back. There we go. 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 And there we go. Let's pick up the screwdriver. Whoa! It's like bending her back into like it's like the shape it's supposed to be in. Pick up the tongs. Oh! Ew! Inner body fusion cage. Ooh, so I don't even understand how any of that works. Like, this is not a good this is not a good thing for like actual medical advice. These surgeries have to be a lot more complex. Needle, thread, suture for you, suture for you, and suture for you. You done a fabulous job, doctor. I'm sure the patient will recover in no time. Are you sure? Are you sure about that? Because that surgery tripped me out, bro. Alright, last one we're going to be playing today is eye surgery. My personal favorite, probably because of the music. Like, awesome. Don't try this at home, obviously. Your patient today is Marie Wilson. Returning to school after summer vacation, she noticed that her vision has got blurry. An optometrist has diagnosed her with clouded lens, also known as a cataract. Right? You will need to replace Miss Wilson's clouded lens with an artificial lens that will clear up her vision. Alright, Doc, which operating room should we use? Obviously this one because it's got the eyes. Later, Mr. Local anesthetic to numb Wilson's eyes before we begin. Please put the drops in both eyes. Ooh. What? That looks like either pea or lemon juice. Alright. There we go, Miss Wilson. Whoa. Alright. Speculum. There we go. Polishes a incision in the cornea. Knife. Give me the scalpel. Alright, here we go. Oh! You're like stabbing the crap out of her eye. The ridge. That will eject this. What is it? Saline? Alright, keratome. There we go. Let's shove that in there. Oh! Oh, that is so scary. Let's pick up the needle from the table. The needle! Alright. Ooh. Oh my gosh. Okay, forceps. There we go. Yo! Oh my gosh. Alright, rotator. I was just like, wait a minute, where's the continue button? There's so that stuff is like making the oh crap, an ad's about to show. Alright, we're back. Lens has been separated from the eye. Now let's get the phaco probe. No! I grabbed the wrong one. That was the irrigation probe. Oh my gosh. Great. Now we can get the irrigation probe. That will suck all the bad leads out of there. Alright, let's pick up all of the nasty stuff. Alright, now let's put in the artificial lens. There we go, shove that in there. Whoa! Poof! Alright, remove the speculum. To prevent the eye from leaking as it heals, we need to hydrate the incisions to make the tissue swell. Grab the syringe. Alright, there we go. I just put an eye patch on her. There we go. That's it. Good work, doctor. Another doctor will now perform the same procedure on the other eye. I'll do that later. Wait, she's got. Wait. Wait. My brain just froze. Alright, that's it, guys. Don't forget to subscribe to my YouTube channel. And stay tuned for part 3 of Operate Now. Bye!